A colleague, Alejandra Flores, will pass down the mic. 2 questions each, please. Let's kick it off with Craig Wall.
Here we'll go on topic because I know there's a lot of questions about the restart. There's a number of parents who are complaining about the whole testing protocol. They want to know what's going on. What is the plan for testing students when school resumes?
Well, I'll start and then I'll ask Dr. Torres to come up. I believe that we provided a lot of information, but if parents don't have it, then we need to do a better job of communicating. But we're going to follow a very similar protocol to what we had last year. If there's a need, we're going to be making sure that anyone who tests positive, we're going to be testing on a regular basis, but obviously anyone that tests positive, we're going to follow the CDPH protocols, and that information will be readily available to parents before the start of school. Dr. Torres?
So testing is one of the mitigation filters and factors that it's important to keep our schools safe, along with universal masking, 3 feet distance wherever possible, hand washing, ventilation efforts, and so forth. Our testing will be offered weekly for students and for faculty. As you know, CPS employees are required to have the vaccine by October 15th, and until then, those who are not vaccinated will be required to test on a weekly basis.
And I would just add, this information has been provided obviously at the school level, so the best place for parents to start if they still have questions is to talk to the local principal. What I would also encourage is go through the school. Experience what the various mitigations are from when you walk in the door to the classroom that your students will be occupying. I think that's a really important way for parents to allay any concerns that they have. But our #1 priority is making sure that our schools are safe. We believe that they are safe based upon all the mitigation efforts that we took last year, and listening more, in addition to parents, to teachers, to faculty, staff, and other stakeholders in the community. We made some other enhancements, and we'll be flexible as the school year rolls on. But starting on Monday, we believe that the schools are safe and ready to welcome students full time.
Do you want to stay on topic first, or do you care if we veer off?
Go ahead.
All right. So just need to ask you about this. First time we're getting to see you since the city worker vaccine mandate came out. Obviously, you're offering, at least the governor is offering some testing options as opposed to those who don't want to get vaccinated. Are you considering giving a testing option for city workers? And as far as your staff, is all of your staff vaccinated, and what happens if they don't?
They all have to be, my staff all has to be vaccinated. They all know that. I think the majority of them are, but they have to be vaccinated. There's no room there. We can't, we have to lead by example. We have to make sure that our folks are vaccinated. So let me just step back and kind of take this issue in a larger frame. Throughout the pandemic, we heard from workers really all across the city, in city government, in our sister agencies, that they were nervous, that they were scared, that they wanted a safe workplace. With the vaccine, we can provide exactly what the workers asked for, which is a safe workplace. When people are vaccinated, they're being safe for themselves, their family members, but also their colleagues. So creating that safe workplace that I think we all want to get to, the vaccine has to be mandated. And I also want to be clear, there is a lot of conversation about testing, and we're having those conversations with our colleagues that represent the public employees. But to be clear, testing is a point-in-time indicator of where you are. It is not a substitute for the vaccine. It just isn't. The only way that you can feel safe, not even feel safe, but be safe from the virus is to get vaccinated. And I want to emphasize this point again. When we see that 97% of the people that are showing up in hospitals and going into emergency rooms and being very sick or worse, dying, 97% are unvaccinated. That's a stunning number, and something that we all should take heed of. The best thing that we can do for ourselves individually, but what we can do for our families and our workplace is to get vaccinated, which is why we're pushing this. It's about safety in the workplace. Yes. Can we give him a microphone so I can hear you, but
Obviously,
folks at home.
unions say that this is a collective bargaining issue. It's been raised by police, it's been raised by other unions. How do you mandate something when it has to be bargained, and will people be fired if they don't?
So let's be clear, we always want to engage with our unions on any issue that's going to affect their members and certainly their workplace. But it's a condition of employment. We are in a pandemic. We have a deadly variant that is killing people in our city every single day. We have people in hospitals who are clinging to life because they weren't vaccinated, and now they're in a terrible medical condition. And let me talk for a second about first responders. We have first responders that are in hospitals. The vast majority of them who are the sickest are people who are unvaccinated. This is not a nice notion. This is an urgent crisis that we have to address. We have a tool that has been given to us that we know is proven. 99% of the people who get vaccinated never get sick again. 99%. So it's in all of our interests to do what is necessary to take advantage of the life-saving tools that are right at our fingertips, that are free and readily available, and that's the vaccine. We have to do that. Those discussions obviously will continue, and I'm not going to negotiate here in the press. I understand there's a lot of concern, there's a lot of fear. We've got to continue to break through, I think, a lot of myths that are still out there about the virus, about the vaccine. We've got to educate folks, but we need to move forward decisively with this vaccine because it's the only way we get to a safe workplace, which is what workers have demanded. I've had a number of employees from across the city reach out to me to say, thank you, Mayor. We need this to feel safe coming into our workplace.
Mayor, Marianne Ahern from Channel 5.
When you say condition of employment, just following up on what he had to say, so that does mean if you're not vaccinated by October 15th, you're no longer working, and why?
Well, what I want to say here is we need to continue the discussions with our friends and colleagues in organized labor. We want to, I don't want this to be a punitive thing. I want people to get vaccinated to save their lives. That's really what the emphasis on. And what will we need to do to break through to get people comfortable so they will get vaccinated? I don't want to go to the punitive place, which some people like to go to right away. What I want to do is create a safe workplace where our workers feel comfortable coming to work and also interacting with members of the public. We've got a lot of frontline employees out there who are interacting with members of the public every day. We owe it to the public to also make sure that we're protected so they can be protected. So there's a lot more conversation that has to happen. There's a reason why, even though we're announcing now that we set the deadline for October 15, and I feel comfortable that through conversation and dialogue, we'll get to a place. We're not going to satisfy everyone, but we'll get to a place that I think is the right place through conversation, through collaboration, and work through the fears that we're hearing articulated by the workers. We need to address those fears. Those fears are real, but we've got to get to a place where we disabuse them of a lot of the misinformation that continues to permeate social media, in the media, about the vaccine. We're hearing a lot of it in these conversations, which I think ultimately is a healthy thing, because then we can provide them with the facts and the truth.
Back to school opening,
Yep.
We did talk about being flexible. And since children's hospitals are reporting an increase in children in ICUs, not just with COVID, but other illnesses, corporations are delaying returning full-time, to the office. Why are you so confident that learning is going to be safe?
Because of the mitigation efforts that we put in last year. We studied a lot, for example, the Archdiocese schools that opened full 5-day back last September, and had, I think, great success with their mitigation efforts. We built upon that. We opened our schools, as you remember, elementary schools first, and then high schools, and we opened them at a time where case rates, percent positivity, was actually higher than it is right now. And we didn't have the level of vaccination that we do right now. An agreement that every adult in the school system will be vaccinated is really important. And we obviously took a lot of steps as soon as we were able, and it was available first with 16 and over and then 12 over and up to get our young people vaccinated as well. So I feel very confident that if we follow the science, and the science tells us that young people do get this at a much lower rate than anybody else, and if we continue to make sure that we make the vaccine available where students and their families are, and continue the mitigation efforts that, if you followed us around today, you saw existing in this very building, that the school environment is safe. But beyond that, what we also know is this. There were 30,000 young people on a daily basis last year, school year, that didn't connect, weren't on remotely, weren't coming to school in person. We do a disservice to those kids and their families if we don't provide a safe and nurturing environment for our kids to learn. As you heard today, and we know from across our schools are more than just places where our kids learn their ABCs. They get fed. In many instances, they get health care. This being in person in school is critically important to the safety of our young people. Go ahead, Mary Ann.
Why wait till October?
I'm sorry?
Why is the date October 15th?
Here's the reason why. Okay. For people who have not been fully vaccinated, assuming they're taking Pfizer or Moderna, you got to get the first shot. There's a period of time. Before you can get the second shot, and then 2 weeks after that is when the science tells us that you have the highest level of immunity. So we want to give people plenty of time in that, given those milestones, to get vaccinated, fully vaccinated, not one shot if it's Pfizer or Moderna, but 2 shots, and then 2 weeks after to then have the highest level of immunity. We want to give people time.
Alex Nitkin from the Daily Line. Yesterday, the Planning Commission approved a plan for a new apartment building near O'Hare, even though Alderman Napolitano opposed it. Are you going to be asking aldermen on the Zoning Committee to vote in favor of that proposal, even though their colleagues are against it?
Well, what I know is that we have an affordable housing crisis in the city, and we've got to look for lots of different ways to fulfill our need and obligation to shrink the level and the level of deficit that we have in affordable housing. Everything that I know about this project is it's a good, solid project. It has affordability built into it, and we'll continue in dialogue with Alderman Napolitano, but of course members of the Zoning Commission. We think this is a solid plan, and we'd love all the members' support, but there's more discussion that has to happen, and we want to make sure that we leave space for that to take place.
Mayor, Nader Issa from the Sun-Times.
Mayor, last time CPS started its school year before Labor Day, the first